His exact reaction, however, he is in Washington, D.C. But Sean Spicer, Communications Director for the RNC, joins me now from outside the Supreme Court. And Sean, what is your reaction? Obviously, a win is a win for the Obama administration.
Well, Thomas, good morning. I think that today the court ruled that Obamacare was constitutional. I think this November the voters are going to have a choice to vote on whether or not to fully repeal Obamacare in terms of the policy. So today I think we set up a stark contrast for the November elections. You have a president that wants to implement this health care bill that's going to cost us more. The court confirmed today that, in fact, the mandate is a tax, and it's going to it is already shown to allow fewer choice in the health care market. Mitt Romney has made it very clear that on day one he will repeal Obamacare and institute common sense reforms in health care that address the problems, allow for greater choice, more opportunity, and better health care without putting government in the middle of between patients and their doctors.
Sean, when we talk about the money, though, according to the CBO, which is a bipartisan office, the Congressional Budget Office, the law is expected to spend a bit over $1 trillion over the next 10 years. There are spending cuts which do fall on Medicare. Tax increases are expected to either save or raise a bit more than that, which is why the CBO estimates that it will slightly reduce the deficit. And then as we look at this going down the line into the future, they say as time goes on, the savings are projected to grow more quickly than the spending. And the CBO expects that the law will cut the deficit by around $1 trillion in its second decade. How do you expect to get Mitt Romney, a man who is considered to be the godfather of getting health care passed in Massachusetts, into the White House to repeal this when that was his greatest piece of legislation as a governor?
Well, first thing, what Governor Romney did in Massachusetts, he's made very clear, was for Massachusetts. He's made very clear, as most Republicans believe, that states should do what's best for states. The federal government does not need to get involved in a national mandate, and Governor Romney's been 100% consistent that states should do what's best for their individual states and not necessarily put that on the burden on the entire country. Second, with respect to the costs, you're right. The Obamacare cut $500 billion out of Medicare that seniors depend on. Two, it raised significant taxes that every American's now going to have to pay. And three, with respect to the CBO, I think everyone who's looked at that recognizes that the Democrats put serious constraints on how the CBO's ability to score that was portrayed so that it gave the best possible outlook. There is no one that can honestly believe that this isn't going to add additional trillions of dollars to our deficit and raise the household costs for every family and business that's out there. And I think that's the other aspect of this, Thomas, is that right now, job creators, we have a problem. The president took his eye off the ball the first couple of years. Instead of focusing on the economy and jobs, said, I'm going to focus on health care. And right now, job creators are saying one of the biggest inhibitors to hiring more people is this law. So, you know, I'm not sure how today can anything be but a bad sign for the economy and American families who are struggling already.
Sean Spicer from outside the Supreme Court with the RNC. Sean, thanks so much. We want to bring back